So let's start with something that's interesting. What's safe and legal? Smoking in public, such as the beach in a car. Any wisdom on when it's taken out of your home? Joe, you want to try that one?
So yeah, I can definitely take this one because this is a question that I get a lot in my line of work. So within the United States, public consumption is still illegal, which means that in any public space or outside of a private residence, whether that's yours or someone else's, you are not allowed to consume cannabis, medical or otherwise. Now, that distinction does not apply to what's considered a low THC product. Those actually are considered legal for public consumption. However, I wouldn't advise putting yourself in a situation where a law enforcement officer is going to come up and ask you what the THC content is of that particular product. It's best to just not use cannabis in public, at least within the United States. You go to Amsterdam.
Some good advice is don't tempt them.
Yeah.
Change ROAs. Go to a different ROA that's inconspicuous.
Yeah,
exactly. You know, and you know, not everyone in law enforcement is quite as, you know, informed on what some of these restrictions are. So if it looks like weed and it smells like weed, they're going to assume it's weed, and that's their job, is to enforce the law. So my advice to people who come in and ask these types of questions is don't put yourself in a position where it even looks like you're violating the law. Right. You know, and most of these questions involving taking it out in public, taking it out of state, which it looks like is the next question. The short answer is no, and the long answer is still no. Like, it's, you know, we're moving in the right direction, but within how the laws are right now, you are breaking federal law if you consume cannabis in public or take it out of the state.
Right. I think, you know, what's important to point out is that when you go into an airport and you go into that TSA terminal, you have now gone into federal space. In federal space, cannabis is illegal in federal space. So again, the TSA has made it very clear they're not looking for cannabis, but don't put a vape pen, don't put product, don't put it on the tray when they're going through there, because you're just tempting these guys. They don't want to do it, but they will, and that's their job.
Exactly. You know, and the answer I usually give when that question comes up, and I get this question at least once a day, is, like you said, Mark, you're not their priority necessarily. They're not looking for someone like you and what you may have on you. But if it becomes apparent that you are transporting product across state lines and they wanted to make an example out of you, there's nothing stopping them. That is within their rights to do, and you are violating state and federal law.
Again, just don't tempt the bear. That's all. It's there. Now, there's one other question that says, I recently moved here from Pennsylvania and wanted to know the laws or regulations on using medical marijuana while driving. I think there's really kind of two answers to this, and I'll let Joe answer one of them, but I'm going to answer one up front. Cannabis is much like any medication that you take. And if you read the label on almost all medications, they warn you about operating anything, moving vehicles, tractors, forklifts, or anything under using that particular using that particular product. Be very careful, because again, you have to know your limits. And I don't suggest driving and using cannabis either medically or recreationally. So first of all, treat it just like it's a pharma drug and be very, very careful. I think also, Joe, I'll let you tackle this one. I think that smoking cannabis behind the wheel of a car really is not only tempting the bear, but something I just really don't recommend.
Yeah, there's a lot of things that can get you in all sorts of trouble in terms of operating a vehicle and using medical cannabis. For one thing, as you said, you know, you don't really know what your level of impairment may or may not be, and that's not something you want to tempt for the safety of yourself and those around you, anyone in your car, anyone else on the road. You know, similar to alcohol, although there may be different effects, you don't necessarily know how it's going to affect you. Everyone has a different level of tolerance and reacts in different ways. So it's not something where you want to really roll the dice, especially if you're, not used to it. As far as the law is concerned, for one thing, consuming cannabis while driving, yes, is still illegal. And even if you're not consuming it while driving, or you didn't consume it before you drove, let's say you just went to the dispensary to pick some product up and your plan is to just take it home and use it within, your private residence, which is legal. If you are pulled over on that drive home, and I think in Florida, the law states within arm's reach, if the product is within arm's reach, that is against the law if you're driving. If you're a passenger, I think it's slightly different, but the product should always remain out of arm's reach of the driver. So in order to, again, prevent yourself from getting involved in that situation and poking that bear, put it in the back seat, put it in the trunk, even, just put it somewhere where you're not tempted, or doesn't even look like you could be tempted to access it while you're driving, because that is going to be problematic.
I think it's very much like open container in alcohol. Just don't have it there.
Very similar system.
Right. Do we have to allow the search of our vehicle if it smells like marijuana? Well, the operative word is, do you have to allow it? The answer is, I believe that a police officer, if he smells it, has the right to search. Your thoughts on that, Joe?
Yeah, so
I don't think you have the choice, is what I'm trying to make.
No, I mean, first of all, the officer is going to be the one who determines whether or not your vehicle smells like marijuana. That's not your call. So if they feel like your vehicle smells like you've been consuming marijuana or storing marijuana, they do have the right to search your vehicle, and they can and will get a warrant if they feel it's necessary. So it's one of those things where, if they ask you, do we have the right to search your vehicle? I think it is within your rights to say no, but they can overrule that if they feel that's necessary. And at that point,
you brought up a good point earlier, Joe, and that is not all the police officers here in the state of Florida are on board. In other words, it's a matter of training. It's a matter of knowledge.
Exactly. Some of them are knowledgeable about it. Some of them are knowledgeable about how the system works. Some of them aren't. Some of them are open-minded. Some of them are not. So, it's just one of those things where, again, you don't want to put yourself in that position in the first place. Right. People talk about air fresheners and coffee filters and all these different things that can supposedly, cover up the scent. Do you really want to take that risk?
Well, I think it boils down to something that's even simpler than that. If you have medical cannabis and you have it in the container that it came in other words, the label is still on it, and you bought it legally, even if they search your car and find it, you're safe. In other words, you followed the law. Now,
exactly.
If you have 2 or 3 joints just laying out next to you in the car outside of their container, then that could be a different issue. And it's very much like open container in alcohol. Treat it that way, and you'll be in good shape.
That's another very good point, Mark. And that's something that there's a protocol that we have here at Surterra every time we check a customer out for that very reason. And that protocol is we put labels on every single product that has the patient's name, the name of the product, the name of the prescribing doctor, the date that they bought it, and the milligram count.
Right.
As you said, if your product within your vehicle is within those containers and still has the label on it, and again is out of arm's reach, then that's legally within your possession and there's nothing to prosecute.
Right.
But like you said, if it's just random joints in your ashtray, they're going to have some questions and you're going to have to provide them with answers.
Yeah. So, I mean, again, just use common sense, right? Again, I wish that we had more education and open-mindedness with the police. I think there are some police I know that I've met that have been very open-minded about this and do follow the law. In fact, I've been in seminars where policemen attend just to get educated. But on the other side of the coin, just don't tip the bear. I think that's the best way of handling it. Now,
100%.
One of the other questions is, do you have to carry medical marijuana in an approved or sealed container? The answer is no. I think as long as you have the sticker on there, I think you're good. Is that right, Joe?
Yes and no, because yes, as long as you have the sticker on there, it proves that it's yours. That being said, to take the sticker off of the container and put it on a different container, for one thing, seems kind of like unnecessary effort.
Right.
And for another thing, as someone who deals with these stickers every day, good luck getting it not to fall apart in between taking it off of one pack and putting it on another.
Yeah.
So, the best thing, technically, yes, I believe you're right. You as long as you have that label on it, you're safe within the law. But if it's already in a container that's designed for that product and you're going to be transporting it, the easiest thing to do is probably just keep it in that container.
Right. Yeah, and I do recommend putting it into a bag, not necessarily a sealed container, but a bag or something that really keeps all your cannabis really together. I mean, that helps quite a bit. That's out there. What are there new methods of delivery, routes of administration, and development? You can take a shot at that one, then I'm going to have one I want to make a comment.
Yeah.
I would take that one, please.
So that's a complex question because there are certain things that may be new to the Florida market that they've been doing in other places for a long time, such as beverages, for instance, which are still not approved within the state. But if you go to Colorado, California, Washington, Missouri, where I'm from, they're everywhere. So are those things being discussed within the state, within current MMTCs? Yes. Is there a realistic timeline on when you might see those in the stores? I don't believe so. Right. It's still something that's kind of just being discussed right now.
Yeah, like beverages. I know that's something that's all under discussion right now.
Right.
I do think it's important to point out that under routes of administration, if you take a look at the right over here, you take a look at what you see. What you're going to see is there are under, for example, if you take a look at edibles, suppositories fit in that category. If you take a look at topicals, there are metered dose inhalers that are out on the market. And is that a new product that's been out there? It's not a category by itself, but it definitely is a new product. There's transdermal patches. Then there's also some firms that have vaginal sprays. Again, not a new product. It's been around for a while, but it doesn't necessarily have its own category. So there are new products being put together in each of the routes of administration, not necessarily a new route of administration. That's it.
Absolutely.
Good. Okay. Why the doctor visit way before a year when the card lasts a year? That is an excellent question. I mean, I've always questioned that. I wish that my the answer when I ask the officials is because what they want to do is they want to make sure that your doctor is in fact working with you, giving you the right dosing information, and that you are in fact in touch with the doctor for the dosing information and also for any questions you might have to answer. So it was kind of a move by the state to make sure you're getting the support from the doctors that you need. Although it does cost additional money, and there's a lot of questions as to whether it's really needed. I wish after 120 days, the herniated discs in my neck would go away. They are not going away ever, but it's a condition that the doctor has to definitely verify. So it goes back to this chart that you see here, where you're on this 35-day clock on flower, you're on a 70-day clock for everything else. But after your first cycle, your first of recommendations, during the second one, you will have to probably renew your card. And that's why the card is there. Again, it's done by the state to make sure that your doctor is engaged with you and you're getting the support that you need. I'm not necessarily in favor of a second visit, but it's something that I understand why they did that. Joe, your comments?
Yeah, it is something that obviously comes up all the time, especially when you're in a dispensary as busy as the one I'm in. We see an average of 150 to 250 patients a day, and a lot of them are seasonal. So, when they leave to go back up north, everything might be all good. They come back 6 months later and either their card or their recommendation is usually out of date, sometimes both. So, it's one of those things where you really just want to keep track of it. The card itself, as long as you have it, as long as you receive it, is easy enough to keep track of. It actually has the expiration date printed on it, just like your driver's license. And usually the state's pretty good about sending an email about that within 30 to 45 days before that card expires. And then you can either go through that process to renew it online. Some doctor's offices are willing to help you through that process, or you can call the MMUR office and have them walk you through it. Or I think you can do it on paper, but that takes longer. I think you mentioned that in your video. But you always want to make sure that you're keeping track of when does my card expire and when does my recommendation expire, because if either one of those things lapses, you cannot buy product until it's renewed.
Yeah, and I want to pull this. I want to pull a couple things together. One is this, and also the fact that the police have the ability to be able to look into the registry to find out if you do in fact have a card, and if you do have in fact have recommendations in those areas.
Absolutely.
And this is actually good, because what it does is it verifies that you in fact are complying with the law, and it's not a random decision that's made by the police itself. But again, it all fits. And as you mentioned, if you leave the state and you come back, please make sure you keep at least keep your card up to date, the registration card. And then when you get back here, make sure you get the recommendations up to date with the doctor, so that you are in fact complying with the law there. Cool. Let's move on to the next question. Been in Florida for 25 years, sold my house. I'm looking for another. Can I still keep my medical marijuana card, or do I have to apply again? I think as long as you're a resident of the state of Florida, and so it's not just a matter of having a house. If you have a bank account, if you have a driver's license, again, if you have a rental agreement, something that proves that you in fact have spent more than 2 months a year here in the state of Florida, I think it really applies. Is there anything else that you can think of, Joe?
Yeah, everything you said checks out. The only thing that came up in my mind is once it comes time to renew that card, you are going to want to update your address within the state registry, so that new card has your current address on it. Right. Other than that, until that card expires, as long as you're still a resident of the state, you're good. But once that card expires and you go through that renewal process again, you're going to want to update your address to make sure all of that fits within where you're currently staying.
Yeah, and I should mention, I just moved from one location to another about 3 months ago, and the state was pretty quick I got a card within a week, so I was surprised how fast they actually keep that.
Yeah, they've gotten a lot better at it over the past few years. Everything's happening a lot quicker. Like, it used to take 2 weeks just to go through that card renewal process in general, and now, unless you're flagged for some reason or your payment doesn't go through, you can get your card renewed within 10 minutes, and then you just wait for the new one in the mail. Really so they've gotten a lot better at expediting a lot of this, but it's still something you want to keep on top of.
It's kind of an interesting question here. Is what is the probability that the law will pass? And I think what they're referring to is the law for recreational marijuana. And I think I'm going to take a first kick at that, and I'm going to let you talk about this, Joe. That's a good question. And the reason I say that, because the people in the state of Florida really want recreational marijuana. There's been a lot of surveys that have been out there, and it's more than 50%, actually more than 65% of the people are open to having marijuana be legal. Now, that being said, the governor and his people who fund him do not want any form of anything in Florida. And so DeSantis has actually worked extremely hard to not only not support medical cannabis, but done what he can to try to really limit and really hinge and hurt the program. Now, I do think if it's the people's will, the answer is yes. However, our Florida state politicians have done a great job of being able to block in a number of different ways. For example, they've changed the way petitions have to be done. They've changed the way the court rulings are being filed. They stopped people from even assembling from being able to do that. So I think the chances of it passing are good, but it's not going to probably be in 2024. I think it'll happen before the year 2030, and somewhere in between is when it's going to be there. And I'm just saying that at least here in the state of Florida. Now, that being said, I've been in touch with a number of people in Washington, D.C. It is not a political issue in the 2024 election. That's one of what they call the primary issues. Things like gun control and things like that are the primary issues. But it is something that is being acknowledged and talked about by a lot of people. And there's a good chance that by the end of the 2024, or by the end of 2025, that there will be federal movement in this particular area to make cannabis legal. That's kind of my reading of the situation. I don't think it'll be before 2024, but I think right after that, you'll see a lot of movement in that particular space. Your thoughts, Joe?
Yeah, yeah, everything you said is pretty right on, Mark. This is another question that I get a lot. On a state level, like you said, the people are on board. The governor is not. Now, Ron DeSantis at the moment kind of has his hands full with this presidential campaign. We'll see what happens there. We may have a new governor coming up fairly soon, but if it's Byron Donalds or any of these other people who have been touted as potentially being interested, their views are probably going to be pretty similar to Ron,
right.
Which, that can go both ways. It's not necessary. They can't necessarily overrule the will of the people, but they can make it very difficult for certain things to get done. So on a state level, on a state level, I always say we're moving in the right direction. It's going to happen at some point. Is it going to happen as quickly as most people would like it? Probably not. Mm-hmm. Same thing on the federal level. I've worked in this dispensary through 2 different presidential administrations and had people come and tell me, again, every day, the president's going to pass this federally any day now. And I would tell them, I don't highly doubt that. No, they're not.
I don't see that happening until after 2024. I really don't.
Exactly. It's not going to happen anytime within the next.
They're not going to open up a political issue that isn't a major issue and take a stance on it. That's
right. Kind of next year's another election cycle, so they're going to say a lot of things about how they may or may not feel, and that will prove to politicians are politicians. They're going to play their game. We're moving in the right direction. Is it going to happen quickly? I don't think so.
Yeah. What is the current legal limit on THC levels in Florida? I know there was a lot of movement to try to put a THC cap. THC cap on medical cannabis. I don't think there's a cap on the percentage of medical cannabis. Your thoughts, Joe?
So yeah, these numbers, what they consider to be a daily limit, that it's misleading because it's not like if you come into, like for edibles, 60 milligrams per day. Well, 9 times out of 10, a package of edibles is going to have 100 milligrams of THC in it. Therefore, people wouldn't be able to buy any edibles. So what it is they put that 70-day limit and then they divide it by 70 days. And that's where you get that daily number. However, that does not limit you to only being able to purchase 60 milligrams of edibles on any given day. That is the recommended dosage per day. Yeah. So,
and also there's not a limit on the percentage of THC in the product itself, but there is a limit as to how many milligrams and things like that you can buy.
Right. It's all in aggregate. It's a conglomerate amount. So
the operative amount is the 70-day or the 35-day supply limit. That's
precisely, and so people, especially new patients, come in and they're like, so, when am I allowed to come back? And I say, as long as your script is open and your card is good, you can come back whenever you want. I have people who live right down the road come into my store twice a day. Right. So, it is doable. You just have to stay within that 70 or 35-day limit. Right. And then also keep in mind, if you're buying a large supply, since everything is now on a rolling limit, whatever you buy that day, that amount of milligrams, that amount of space will be taken off your script and will not come back until after that 35 or 70 days is complete.
Right. Next question is who decides how flower is dispensed? I think that's the job of the OMMU. They're the ones who decide who dispenses it and who doesn't. Key, can't buy it on the street. You have to buy it from medical marijuana treatment.
Right, and and it all comes into us prepackaged, pre-weighed. So we have people who like they'll buy 1/8 of an ounce of whole flower, take it home, weigh it themselves with the scale they brought at Walmart, and then come back and say that this flower is short. That is something where if you want to make that argument within the company, within a retail space, you're more than welcome to. However, by the state standards, unless you're using equipment that is calibrated and authorized by the State Department of Health and the State Medical Marijuana Use Registry, it's kind of invalid. So you know, the product is flowers dispensed in terms of weight. And depending on whether you're buying pre-rolls, whole flower, ground flower, and where you're buying it from, that can vary in terms of what quantities you're allowed to buy within a certain, you know, package.
Sure.
But
you brought up something really key. One of the keys is you're required as a dispensary here in the state of Florida that use equipment that's approved by them, and that doesn't necessarily match with what they call consumer product.
exactly.
Now, I do want to do something. I was a little bit remiss here. I didn't answer the question about does insurance cover medical marijuana, and the answer is no, it does not.
No.
And I don't think it will cover medical marijuana until it becomes federally legal. The insurance companies are going to do everything they can to not pay, and they're going to stand behind the fact that it's not federally legal. So unfortunately, I wish it would be, but unfortunately right now it just isn't.
Yeah, we get that question a lot. We also get people come in at the end of the year. They want to round up all their receipts so that they can use it as a tax write-off. And I tell them, you know, unfortunately, the federal government does not consider this to be a legitimate medicine or a legitimate business.
Right.
Until that happens, like you said, no, insurance will not cover this, and you cannot use it as a write-off on your taxes. So
now, one of the questions came up. It says, how can I tell how much and when I can buy? Well, I think we showed you a slide on being able to go out and look at, again, the dispensable amount and the amount remaining. I think that's important. Joe, I'll let you talk to this one. But I think the other side of it is, I think as a dispensary, you pretty much can, when you look at the first patient's record, you can tell them where they currently stand, can't you?
Yeah, exactly. So, you know, you can always ask if you can't figure out how to gain access to it yourself, or you look at it, you don't really know what you're looking at. You can always ask a dispensary employee to check your recommendation and tell you where you're at and, you know, how much space you have left. What you're looking at here, there's a little tab on the top where it's highlighted, where the dispensable amount is highlighted. It says see calculation. A lot of times that's what we wind up going to when someone asks that question, because what that pulls up is every purchase they made, what the date was, the amount they purchased, and then to the left of that, it has a date that expires. The day after that supposed expiration date is when they get that amount of milligrams or weight, if you're talking about flour, put back on their script. So somebody will come in and they'll want to buy, you know, a quarter ounce, but they only have 0.126 ounces left. And they're asking, when do I get more? So then I hit that C calculation button and it tells me, oh, on August 13th, you get, you know, half an ounce put back on your script. And then they know, okay, I can come back in on that day and this is how much I can buy. Same logic applies to inhalation, edible, sublingual, topical, oral. The only difference is those are on a 70-day rolling limit rather than 35.
Yeah, and you can see up on the top, there's the tabs on the top left-hand corner here. This, by the way, is a page that's in your portal. I think we showed you in the video presentation. There was another thing called orders. When you expand it, it expands to something like this, and then you can check your edibles, your flour, your inhalation.
Yeah, so everyone has access to this. It's just as easy as, you know, logging into your email or logging into Facebook. If you don't remember what your password is, you can very easily reset it. Your username is always going to be whatever your primary email address is, and the state will have that on file, and so should the dispensary. So you can always ask your bud tender if they can look at it for you, but if you want to look at it yourself, you do have access.
Right, that's through the portal. Right. Let's move on to the next question here. It says, how to request an exemption due to a recent car accident? Well, the way to ask for an exception is to get a hold of your medical marijuana doctor. Tell him that you need an exception in this particular case because you had an accident and you're going to need a little more cannabis of whatever form that's out there, whether it's flour or tinctures or gummies or whatever it is. You make that request. The doctor will then have you fill out a form. That form will then be submitted by the doctor to the OMMU, and within 14 days, they'll say yes or no. That's kind of the process that's in place. You see anything different, Joe?
No, that is the process. And that's another question that we get very often. And I always tell them, you know, that refer that back to your doctor. They'll know what to do. They'll send you that form online, usually, unless some of them require you to make an in-person visit to do that. That is kind of up to the doctor. Every office operates a little bit differently, but they'll either send you the form online for you to fill out and send back to them, or they'll have you come into the office and fill out that form, and then they send it off. And but that doesn't mean that you're guaranteed approval. Like you said, that is up to the doctor and up to the state to determine whether or not that exemption will be granted.
Actually, it's more up to the state than it is the doctor when you really get down to it.
Well, there you go.
So they'll put the onus on where it is. This is a good question here to tell us about exemptions. I asked my doctor to request an exemption since I have cancer, and I have not heard anything from him. I would say the first thing is, if you ask for an exemption and he didn't have you fill out a form, or he didn't start working with you, he's not helping you. Get yourself another doctor. That's my advice. Because typically the doctors, when you make the request, will immediately give you a form to fill out. In fact, in most cases, their website have a link where you can actually go fill it out electronically. And then the other part is they will then follow it up and their practitioners will give you the status, meaning they file it on a certain date and find out when it's supposed to be coming back. If you, in fact, do not have a doctor that's cooperating with you, change medical marijuana doctors. I know that, for example, I work with the medical marijuana treatment clinics in Florida, and you can actually transfer from a doctor to them for $49, and they have a system that they actually use very well to follow up with this. But I would say there's a lot of doctors who candidly are smaller operations. They get busy. Candidly, they may forget, but you're still the patient. They should be taking care of you. And I'd say get another doctor and make sure he's following up the paperwork and giving you feedback on that. Next question. I have here. Can marijuana induce bipolar, mania, or schizophrenic disorders? That's a really good question. There's a lot of medical marijuana research in this particular area. There has been research that has shown that it does help to, or it should say that it helps to trigger bipolar. And there's also medical research that says it does not. The recent medical research that's out there from Israel says it does not. Now, I don't know exactly what they mean by mania, but I think what they mean is that people basically get anxious. When you take too much cannabis, you get past your therapeutic dosage level. Again, as I mentioned, cannabis is not better. There's a certain level at which it works great. And once you go past that, a lot of the symptoms that you were trying to get rid of start coming back, and it might fall into that category. So I would say, can it? Again, the research has said no. And there's research that says yes. I kind of lean towards the recent studies that have been done because there's some credible firms that are out there. I know that in the case of schizophrenia, there's a lot of doctors that have really blamed a lot of that on medical cannabis, but they really haven't found the receptors, and they haven't really found the evidence and the proof of that. But again, it's something that when you get into anything that has to do with any psychoactive type of a program, cannabis becomes a question. And again, it's something that I would say go low and go slow. Take your time using it, use small amounts of it, stop using it and find out if it makes a difference. And if you use a little bit of it, you should be able to, again, find your therapeutic dosing level. I found that if you get the right therapeutic dosing level, a lot of these questions go away. And if you don't find it, then you have a problem. Joe, you have any comments on that?
So, yeah, Mark, in addition to having worked within the cannabis industry for 4 years, I also have a psych degree. So I am at least somewhat familiar with how a lot of these disorders work. And I'm kind of with you in that there's research on both sides. However, research that's come out within the past 10 years, has overwhelmingly generally pointed to this not really being, I don't want to say it's not a factor, but is it something that could actually trigger this type of, these types of disorders to manifest themselves? I doubt it. Everybody's different. Brain chemistry is very complicated, but like schizophrenia is caused by excessive amounts of dopamine in the brain, and that's not something that smoking a joint is really going to have a major effect on, at least as far as I understand. So, a lot of these things are genetic, or they can be brought on by environmental factors. However, it's tough to say whether or not any substance can can cause something like that, especially something, like THC. So
they have found that if you do the proper dosing, that it really helps to control that.
exactly.
And I think that if you just again,
Right.
if you get past your therapeutic dosing level, there's a lot of things that can happen because every person's body is different. But I think the key is you're not going to die. Okay,
Right.
that's the key. But I think you will find that there's something that's there.
And going off that point, Mark, we do have a lot of patients who come into my store who do struggle with mental illness in various forms. And a lot of times they're using this to try and help moderate some of those symptoms. So, everybody's different, but it's either helping or hurting, and dosage has a lot to do with that. So it's one of those things where you got to kind of use your own judgment and hope for the best. But that's why there's certain products that we don't recommend to everybody. If a first timer comes into my store and they're 70 years old and they just want help sleeping because they have restless leg syndrome or arthritis, I'm not going to recommend concentrates that have excess of 800 to 900 milligrams of THC, because that's going to be overwhelming. I don't think it's going to give them schizophrenia, but it can definitely be, uncomfortable, like you said, and that's a term I use every day. You're not going to die, but you may feel like you're going to die for a little bit. So it's one of those things where just everything in moderation, pay attention to the dosage, use your judgment, listen to your doctor, listen to your bud tender, and go from there.
Right. This is a very good question here. Do you have a list of doctors or know of any doctors who work with patients on medical marijuana? I was dropped by my primary. So I'm going to look at this from two different directions. One is, where do you find somebody who's a list of qualified doctors? And I think this is a good slide right here. There's a list from the Know Your Facts. It'll give you a list of physicians. Also, candidly, the medical marijuana treatment clinics of Florida are doctors that really work with medical cannabis and can prescribe medical cannabis for you. I think that's one part of the question is, where do I find a medical marijuana doctor, especially if my doctors drop me? Now, the other side of that question is something that happened to me is that I chose to use medical cannabis for a medical condition rather than a pharma drug prescribed by my doctor. His exact question to me was, "Do you know more than I do?" And I said, yes, because he doesn't know medical cannabis. He doesn't know what the endocannabinoid system is, and he is very close-minded. And I'm not going to go putting, to be blunt, things that I consider to be poisons in my body when I know that they are definitely that. So he and I kind of agreed to part ways, and I did find another doctor. Now, I think the best thing to do when you're trying to look for a medical doctor and you're using medical cannabis is to ask him up front. Just tell him, I use medical cannabis. Do you accept patients? That's the best way of putting it. And I think if you get a hold of people like Advent Health, you get, the Florida hospitals here, they'll tell you which doctors do and do not exactly support patients that have medical cannabis. It's here. That's how I found my new doctor. I just called the overall group and said, tell me in my area, tell me the doctors in your practice that actually will work with patients with medical cannabis. And they gave me 3. Give you an idea. Okay. Guidelines for use by healthcare professionals with medical marijuana cards. Well, again, there's two ways of looking at that question. One is, can a healthcare professional have a medical marijuana card? And the answer is yes. There's a lot of RNs, LPNs that have medical marijuana cards. The guidelines are get a medical marijuana card and just follow the rules and regulations on that. And in many cases, a lot of hospitals and medical professionals, again, are open to that. Now, if you want to be a caregiver, if you're, again, an RN or an LPN, and you want to be a caregiver, then you have to apply for a caregiver's card, again, as a non-relative or as a relative. Any thoughts on that, Joe?
It's one of those things where it really, from what I've seen, it depends on who you're talking to. You may ask 10 different doctors and get 10 different answers. I mean, you got to kind of just, as you said, be open and upfront about what your use habits are, what you're trying to use it for, and then, take their professional advice.
Yeah, what you will. In my particular case, I had knee problems. I had a knee replacement. I was working with a doctor at Jewett Orthopedic, and they were very open to me using medical cannabis. In fact, I was part of their study study whether medical cannabis was effective for post knee replacement pain management. And it turned out it was. It was very, very effective. It was much more effective than any of the opioids that were out there. So again, ask the question, and there are professionals that really look at doing that. The guideline is you are not going to be penalized by using medical cannabis if you're an RN or an LPN.
Exactly. I will also say that, and this is something I found out a few months ago, if you are a current patient or have been a current patient and user of medical cannabis, and you plan on having any sort of operation that requires anesthesia, that is definitely something you're going to want to let them know about, because that can greatly affect the dosage of what they need, what that anesthesiologist needs to give you in order for that procedure. You do not want to wake up in the middle of an operation because, oh, I forgot to tell you, I've been, smoking weed for the past 6 years. Right. So that is definitely something where you're going to want to
let your doctor know this is what you're doing. That more is better. More information.
In general, just be open and upfront. And like you said, if they are not open to that, then you may want to find a new doctor, or just agree to disagree and take their professional advice on other topics.
Right. Good question here about what is good for Parkinson's. I recently have been working with a number of patients in the Parkinson area. I did some research into it and found that, especially in the last couple of years, they have found that especially CBD with THC works very effective to address a number of conditions with Parkinson's. In fact, I'm working with one patient. I met her yesterday, in fact, again, as a follow-up visit. And it turns out it's done tremendous things to help her with her tremors. It's done a lot to help her with her mood, for example, and it's really helped a lot with the pain. But again, it's a higher ratioed CBD to THC product that we found that she works. We did start with a 1-to-1, and it did a nominal dosing, and then kind of migrated into as we could fine tune it for the tremors and for the pain that's really out there. So that's the research that I found and I've been working with. Do you know of any other options, Joe?
So everything you said checks out to my understanding and to what's listed on our Surterra product line. The doctors are usually really good about knowing the products and recommending certain things within that wheelhouse. So as soon as somebody comes in with Parkinson's, even if they don't quite have the understanding of what it is they're looking for, the doctor usually does, and we'll just give them, that information of this is what you're going to want to ask for. Right. And what we usually recommend for people struggling with Parkinson's, like you said, is usually something with a high CBD or 1-to-1 content, because that conjunction of the two seems to work best for something like that.
And the caveat with not only cannabis, but the caveat with pharma drugs is that every person's body is different. That's why the doctor says, take 2 pills and call me in the morning. They want to figure out what your dosing is. The nice part about cannabis is you can figure it out yourself as you go along. But the point is, let your doctor know, monitor yourself. Your body will tell you what's working and what's not working. Your body is the best doctor in this particular case. What's the best tinctures for sleep or motivation for daily use? That's right up your wheelhouse, Joe. In fact, Forrest, you might want to even take that one. You've been too quiet.
Well, sleep, we have a product called Dream.
That's right.
That's one of our best products. That would be the first thing that I would recommend for sleep. And for daytime use, so I actually like products for daytime use as well. It really depends on what you're looking for. And what you're trying to essentially medicate for. High CBD typically works great during the day because it's going to have low psychoactivity to allow you to be able to continue to do what you need to do during the day. So I personally look for higher THC products during the day, but if I am going the THC route, I typically will look for a sativa type based strain that has something usually like a limonene in it, is a terpene that my body responds to very well. Keeps me focused, keeps me going, and keeps me motivated all day long. Those would be my recommendations on that one.
Yeah, you got some great product names like Dream. That's sleep, right?
Yeah, exactly. And that's the nice thing about it when you're navigating it, especially at Surterra, is that the names of the products kind of give you an idea of what it is that it's going to do. And like Forrest was saying, when you're looking at things like this, you really want to look at the terpene profile, because that's what's going to tell you, what type of effect to expect. And again, everybody's different. So, it's not something where we can guarantee a certain effect, but we can say things like, in general, this is the feedback that we get. These are the effects that I personally have had with this product. And so we've got things for sleep. We've got things for energy. We've got things for all sorts of different ailments.
And you have some consultations that people can take a look at, so you can follow up. You can have some recommendations that come up on your products. The consultations, you can sign up on your website. They're free. And then also you can actually follow them up to help make sure that the products that you're using do in fact have the results that you're looking for.
Absolutely.
Yeah. Okay. Wondering about sleep pills. I'm assuming that they are CBN type pills with cannabis. Bought them, but a little worried about taking them for the first time. Your thoughts on that, Joe?
I mean, it's one of those things where you gotta kind of just jump off the diving board. I mean, I wouldn't recommend.
Go low and go slow and jump off the diving board.
Yeah, I wouldn't recommend taking more than that recommended dosage. If they say take one, start with one, and don't go above that unless you really feel like that's necessary after extended use of that product over a long period of time. But if you've already paid for it and they told you, hey, we feel like this will help you sleep, taking one pill, the worst thing that's going to happen, depending on what the product, anything that we sell, the worst thing that's going to happen if it doesn't work is you're going to feel uncomfortable for a few hours, and then you may take a nap, which if you're taking it for sleep, problem solved. But you might feel uncomfortable for a few hours, or you might not get an effect, and then it wears off. Yeah. The good thing about cannabis is within even highly concentrated products, the longest it's going to last if you take distillate is 8 to 10 hours. And some of that can be mitigated. Also, for people who are concerned about, taking a high THC product if they're not used to it, one thing that we always recommend if you're buying something high THC that you're concerned about is buying a high CBD product if you may need to counteract that, right, given, whatever your tolerance level may be. So if this person's that worried about it, I would recommend going to secure something that's higher in CBD content. That way, if it proves to be overwhelming or doesn't give them the effect that they want, they can level that effect off by the use of more CBD.
Right. And I should point out, the pills are edibles. They are capsules. They go into your stomach. They typically will last anywhere from 6 to 10 hours. They might even last longer than 10 hours. Most people who use cannabis for sleep love it because they wake up in the morning refreshed. They don't have any hangover from the drugs. With a lot of sleeping pills, you have this fog that you have. A lot of it is really, they wake up clear-headed and ready for the day. Again, go low and go slow. Don't take 5 of them the first night. Try one pill and really go from there. But understand that they do last between 6 to 10 hours, and most of them will last closer to 10. So, take them, if you're going to get up early in the morning, take them at 10 or, 9 or 10 or 11 o'clock at night, and just plan your sleep cycle. I use for sleep. I don't use sleeping pills, but I use cannabis to sleep, and I use an edible. I'm a chocoholic. I use chocolates. It is an edible, and it does help me sleep at night, and it makes a big difference. If I don't use this type of product, what happens is if I use a tincture, for example, I'll wake up at 2 and 3 in the morning because the tinctures will last 4 to 6 hours. And once that 6-hour time frame wears off, in my case, because I have herniated discs, my pain comes back. It lets me know it's there. It taps me on the shoulder and says, hey, my neck says to my shoulder, do something pretty quick or you're going to really know I'm here. So I found that the edible form, especially sleeping pill, will help quite a bit. But again, go low and go slow.
I was just going to add, Mark, that sleep is really kind of multifaceted. You kind of have to layer on your ROAs because sleep is about both falling asleep and staying asleep. And so something like a pill isn't going to help you fall asleep because ideally you might have been already asleep by the time that thing kicks in. And so you may need to supplement it with, like, for instance, some people will take a vape because that's gonna hit immediately, and that's gonna help you fall asleep. So in order to actually sleep well throughout the night, you got to think about it in those two parts, both falling asleep and then staying asleep, and layering on your products to last you to do that, basically.
Right. Okay, great question here. Pain. Need to know which helps with bad pain. It's related to that as I have chronic pain and neuropathy, and it says marijuana does not help. So first of all, I have pain that without medical cannabis, I can wake up in the morning with a level of pain of a 7 or an 8, which is a lot of pain. I mean, herniated discs in your neck is instant pain. I use medical cannabis. In fact, I tried some pharma drugs. I did not like the effects. They really didn't work as well. Medical cannabis has solved the problem. Now, I do have to say, I had to go through probably 6 weeks of trying different products. We go low and go slow, trying the different formulas, listening to my body, finding out what worked to really dial in the dosing level, how much THC, how much CBD, and what product to use. And because it's a condition that does not go away, I have to have a regime that I do something in the morning, I do something in the afternoon, I do something in the early evening, and I do something in the evening to sleep. Because if I skip one of those cycles, I will have some problems. Let's put it that way. So a lot of it has to do with the regime, the coverage. A lot of it has to do with dosing correctly, finding the right product, making sure you have the right terpene profile that addresses pain. Because there's a lot of people who use cannabis that don't have the right terpene profiles, and that really doesn't matter if it's out there. Now, that's why I will challenge the fact that marijuana doesn't work by itself. Although if you have neuropathy and some other diseases that come into place, there could be some things that come into play that we're not looking at. And that's where, again, working with a doctor, especially a doctor that's favorable towards medical cannabis, can really help. But I think that in my particular case, I use Surterra products. I use them for pain management, and they work very effectively. And again, it goes back to what Joe was mentioning earlier. When I wake up in the morning, I have a vape pen. I take a hit out of the vape pen. It works almost immediately. I also take a tincture drop. That way it works 4 to 6 hours, and that takes me into the early afternoon, of which I'll do the same thing. Actually, I'll take another tinctures in the afternoon, it takes me through the afternoon, and then I'll do something in the early evening. So it's both coverage, product, and also dosing. And unfortunately, unless you want to just be completely comatose, you've really got to be able to experiment with it a little bit, figure out what works, and go through the dosing process. Your thoughts on that, Joe?
Yeah, I agree with everything you just said. It's one of those things where, like you said, it really depends on the individual, what their ailments are, how severe they are. In terms of cannabis in general, THC is generally described as a painkiller. CBD is an anti-inflammatory. Mm-hmm. A combination of the two a lot of times can work well, but it depends on the situation of, how bad the pain is, where the pain is concentrated, what type of products they're using. A lot of times, if it's something that severe, like you said, you're going to want a few different types of products and a few different routes of administration.
Right. And that's what makes it complicated. When you say it doesn't work, it's because probably because of the fact you have to go through different routes of administration, you have the timing during the day and the regime. It's not a black and white issue. It's not 2 pills taken in the morning.
Exactly.
But it does work.
Right. The one thing that you bought may not have solved the problem, but if you buy 4 or 5 different things and use them in conjunction at different times and dosages, you may get more relief.
Yeah, because routes of administration are like vape pens work almost immediately, but only last for 1 or 2 hours. Tinctures will last for 4 to 6 hours, and edibles, capsules will last for, again, 6 to 10 hours. So it's a matter of getting that all right and figuring out which ones are there. And again, pay attention to the terpene. Talk to your bud tender, tell them about your situation, and they'll help you get the right terpene profile that's really out there. I hope that helps answer that question, but cannabis can be a real an avenue for that. Joe, here's one that's right up your alley. What's the best strain for energy and appetite suppressant?
So sativa dominant strains in general are associated with both increased energy and appetite suppression. A lot of that, again, has to do with the terpene profile. There are certain terpenes that can help to either stimulate or decrease appetite. And, again, this is mostly anecdotal because the government's limited as to what research they can do within the United States. But there is research coming out of other countries that shows that sativa dominant strains, are better for energy for most individuals, and will also help with suppressing appetite, whereas indica dominant strains are going to be more generally sedative, but may also help to stimulate appetite. So it's kind of depends on which side of the spectrum you're looking on. But generally, if you're looking for energy and appetite suppression, I would suggest a sativa dominant strain or a sativa dominant blend. And I say dominant because really at this point, everything, at least in terms of the strain discussion, is a hybrid, because these strains have been crossbred so many times for thousands of years. We get a lot of people who come in they'll look at our menu and they'll say, but this says hybrid sativa. I want a pure sativa, or I want a pure indica. And I'll tell them pure indicas are growing in Afghanistan. So if you want to go obtain those from the Kush Mountains, you're more than welcome to. But
in defense of the dispensaries here, a lot of the products now are being genetically engineered for specific purposes, like your dream product, to help with sleep, or to help with pain, or to help with energy. And so they're not as pure as like the pure cannabis and the pure indicas and sativas. Like I say, you almost can't find them anymore because, again, they've been engineered for something. The question is, what do you want? And if you can identify the results that you want, that's what they call cultivars, where they've put together the strain and the terpenes to address that cultivar, to address your particular situation. So I hope that answers that particular question. Let's move on to the next set of questions we have here. Now, these are questions that were brought up by folks in the webinar itself. First question, Joe, this is one that you can take. How do patches work?
So yeah, I think I might have answered this in the text, but just for anybody who didn't see the QA, the patches, at least the patches that we sell, are transdermal, and what that means is they absorb through your epidermis, through your skin, and then are going to circulate throughout your bloodstream from there. The nice thing about the patches, at least our patches, is that you get pain relief with very little to no psychoactivity. So you're able to function throughout the day. You're getting that systemic pain relief, so it's not just all concentrated in one spot, like, say, a topical lotion or balm, which still works really well, but is only really good for localized areas. If you have more widespread pain, a patch can definitely be a good option because it's going to circulate throughout your whole bloodstream, and you're not going to have to worry about psychoactive effects.
Yeah, what it's doing is it's microdosing. It's letting out a little bit of cannabis during the day, constantly. Yeah, exactly. Kind of like the athletes lead 5 or 6 times a day because it's better for your body. It's the same kind of thing with cannabis. That's how the patches work. And they're very effective. I'm really a big patch fan. Michael had a good comment. He says, it may not be addictive, but it is habit forming. I guess you could call it habit forming. I don't know if my craving, or I shouldn't say my craving, my need to get rid of my pain is habit forming. My need to get rid of my pain is what I call a natural reaction. I have not found anything else other than cannabis that can help get rid of my pain and not have me have the negative side effects that you find from a lot of the pharma drugs and anything that's out there. So the answer is this a habit of mine? I don't know if I'd call it a habit. I would say if I could find something else, I'd definitely take a look at it. But I haven't really found anything. I had a friend of mine who was trying to get me into these mushroom things, and I tried a few of those, and they didn't work anywhere near as well as cannabis did. And of course, there are people that say that they do. But again, I will buy the fact that you could look at it as habit forming. My point is, you're not going to die. You're not going to have any negative side effects. You can stop at any point in time. And if you stop at any point in time, you don't have any negative effects, meaning there's nothing, you don't have any of the negative effects that you find if you're smoking or doing something like that. But I do think that it's very important that you pay attention to the fact that you will develop a need to be able to use that particular product in the future. Take a look at it. Anyway, let's go on. Any other comments you want to make on that, Joe?
Not really. I mean, in terms of that question, I definitely agree with what you said. It depends on the individual. Someone who does not have good impulse control and really likes the feeling of cannabis, you could potentially consider that habit forming for them. But on a major scale, I wouldn't say I see a lot of that. No, it depends on the person and what their habits are.
Right. And you're right. You can, let's just say it's become part of my life and it's something that I really enjoy. Put it that way. I also found that I take a professional version of Tai Chi. Been doing it for 3 years. I love it. I'm not going to quit. Is it a habit for me? I wouldn't call it that, but I really think it's great for my health and my mental stability. So something to take a look at. Question is, where can I find the rec bills coming up in Florida? I think there are 2. Joe, are you aware of those 2?
I wouldn't know necessarily where to find them because I'm trying to not dive too deep into that on a day-to-day basis because then people, they just keep asking more questions about the what are the politicians going to do? But, you know, that's all public record. There's definitely places to find it within the state government websites. I'm sure there's dispensaries and activists who also have them listed on their website. So it shouldn't be hard to find.
Yeah, I think the best thing to do would be just Google the recreational bills here in Florida. I know there's one bill that's I think a legitimate bill that really is trying to get recreational cannabis passed. I think there's another bill that's backed by a dispensary that's trying to have them be the only dispensary in Florida that can dispense cannabis, which I would say stay away from that one.
There you go. That's
and so I think there's two different bills. What I'll do is I'll actually find the two different. If you will, and I know you're anonymous, so it's hard to kind of let you know. But if somehow you send me an email to events at marijuanaaware.com, I'll give you the two different bills that are out there, and you take a look at it. Where can I find reliable research you were talking about for bipolar and MMJ? There's really three different sources that I use. First of all, go to PubMed. PubMed is the National Institute of Health research database that is the United States government sponsors, and they have research in there about different conditions and, of course, medicines that apply to that. They actually have over 80,000 different research studies on medical cannabis, and they have bipolar studies and medical marijuana that's out there. And that's one good resource. Please be aware that under the Nixon era, they tried to do everything they could to vilify cannabis, and a lot of the studies that are 10 years old or longer will tell you that it's bad, and all the studies that are recent will tell you that it's good. So you got to kind of take them all with a grain of salt when you have to take a look at not only the timing, but also find out who does the research. What's the quality of the people that are out there? I get most of my research by looking at sources like Canigma. Canigma is a research study group out of Israel. They do a great job of taking the Israeli studies and quantifying them and making them available to the public. They're not necessarily all the studies in PubMed, but it is a research that does come out of Israel, and you will find it there. Then I'd also take a look at resources in the UK, like Global Health and Pharma, GHP, the ones who give us the awards when I have over here. They actually do a lot of research, and they publish a lot of research on medical cannabis, on products in general, but on medical cannabis as well. So there's three different sources that I pull from. And then the other thing I do is I have set up on my email, I actually have a filter that looks through anything that has to do with like medical marijuana and Parkinson's, medical marijuana, and pain, and I actually filter out and find news sources. Google has a research capability to do that, and I actually go out and research them and read those articles on a daily basis. And I think the best thing to do is set up that filter in Google, because if you do something on bipolar and medical marijuana, you'll be shocked at how many studies and research things you find that are out there, not necessarily from the medical databases, but studies that have been done, because there's a lot of smaller firms that do a lot of this research that do publish, but they may not be publishing in the major journal. That's there. Your comment, Joe, do you know of any other sources?
That's a good place to start. You know, there's lots of research, like you said, being done in other countries. There's a lot of, anecdotal evidence that's still being produced within the United States. There's all sorts of different medical journals that are looking at these types of things. So, just kind of start with a source that you trust and narrow it down from there.
Sure. I'm going to go back to a question we might have skipped over. Does vaping inadvertently affect my lungs like cigarette smoking? Cigarette smoking has carcinogens in them, and that's what makes it bad for you. When you are vaping, you're using a steam product, which you're not burning anything. And I think that's the important part about that. And with that being said, Joe, you want to take it from there?
Yeah. So this is another question we got a lot. We got a lot a few years ago, especially when there was a bunch of bad press about vapes being produced that were causing people lung problems. Our vapes are considered medical devices. They're subject to rigorous amounts of testing, and the only thing in our vaporizers is cannabis oil. As you said, vaping and smoking are definitely different. If you're smoking pure flower, then there are carcinogens associated with that because it's smoke, and that's one of the side effects of smoke. However, there are still a lot less carcinogens within smoking cannabis flower than there are in cigarettes, because cigarettes at this point are not just tobacco. There's all sorts of different stuff in there. As far as our vapes are concerned, I can tell you with 100% confidence that the vapes you will buy at Surterra are safe. It's something, like I said, that's brought through rigorous levels of testing. The temperatures that you'd be vaping at aren't high enough to cause any sort of long-term damage. Some people may feel a little harshness in the throat in that moment as you're vaping, which usually either means that you're vaping something where the terpene profile doesn't agree with you, which can happen, which in that case, you would just want to let your bud tender know and they can recommend a different product or a different strain. Right. Or you might be at too high of a temperature. So bringing that temperature down can, decrease the severity of that burning sensation in the throat, but none of that is going to be anything that's chronic. I also always like to tell people that there's a good eye test for what's a good oil inside of a vaporizer and what's not. If you move that vape cartridge or that disposable pen around and that oil looks thin and moves around like it's water or any sort of, very thin liquid, that's probably not something you want to put in your lungs. Cannabis oil is supposed to be very thick and slow moving, kind of like syrup or molasses. If it's thinner than that, there's a chance it's been cut with something, and that's not something you don't want to put cutting agents inside of your lungs.
Right. And there's something that's important to point out here. When you are taking a blunt and you're smoking, when you're lighting it and you're burning the material, that's one thing. That's where anything that's burnt material that goes into your lungs can have an effect. Again, cannabis is not as carcinogenic as cigarettes. Cigarettes are really bad for you.
Terrible.
But smoking cannabis really isn't. It will do. It's not. I'm not saying it's completely free of any problems, but much less. And again, it doesn't have that carcinogenic effect as much as it's there. Now, I will tell you the best way, if you really want to use cannabis, is use a dryer vaporizer. Mm-hmm. Because when you vaporize the product, when you take that cannabis and you vaporize it, you basically aren't burning it. You're vaping it. In fact, what's really cool about it is not only did you get the same effects as smoking, but you can actually take the material that you've used and you can use it in smoothies and things like that afterwards to help you with different things. I recommend dryer vaporizers. I don't recommend lighting up a blunt and smoking it for two reasons. One is because of the fact that burnt material isn't good for you. And the second is the minute you put that 500-degree temperature to that blunt, you're burning off most of the cannabinoids, almost all the terpenes and all the flavonoids. You're reducing the medical efficacy of that blunt about 60%. That's the bad news. Good news is it still works, but you want to really get the 100% there. I highly recommend dryer vaporizer. Stokes and Bickles is the one I have. It's very expensive. It's the Mercedes of the bin, but there are less costly dryer vaporizers that are out there. And that's what I personally recommend is get away from smoking altogether and go to a dryer vaporizer. Your thoughts on that, Joe?
I agree. Those are things that they used to be hard to find. At this point, there's a lot of different dryer vapes on the market with a variety of different functions, price points. So, it's definitely something you can obtain, if not from a dispensary directly. You can find them at a smoke shop. You can find them online. That is a lot cleaner way to use flower and still get those effects.
Right. And I think that gives you the quote unquote smoking effect without all the negative that's there. So I highly recommend. A lot of people don't know about dryer vaporizers. It's kind of a new thing, and I highly recommend. I know PAX has come out with one. There's a number of different product lines that have come out with them that are really good. Like I mentioned, I have one. It's very expensive, called Stokes and Bickle, and it's from Germany. But because I just felt it was important to get the best if that's possible. I hope that answers that particular question. Leanne asked a question. I'm on disability. And way to make it free or cheaper, go to a medical doctor's. I think what I found in this industry is if you have financial difficulties, talk to the dispensaries and talk to the doctors. You'll be surprised how many of these people got involved in this business to really help people with particular conditions. And I think there are programs that are put into place that potentially can help people in that particular situation. Your thoughts on that, Joe?
Yeah, once you get to my phase of it in the dispensary, there are extra discounts that we offer for people on disability. You just have to provide some sort of documentation, and then we put that on your profile, and then that stacks on top of whatever discount we're running that day. Most other dispensaries do something similar. So, the doctor's office, it's not a bad question to ask if they have some sort of program. But even if you had to pay full price for the doctor, you should be able to find additional discounts once you get to the point where you're actually buying the product.
Right. And I think, again, talk to your dispensary, talk to your doctors. You'll be surprised how much they probably have been around and help you quite a bit. Let's see what other questions we got here. I thought if a licensed nurse is THC tested by a company or facility that is zero tolerance, they can be refused a job, fired, and reported hard or not. Is that correct? They can't. If a company has a zero THC policy, they can in fact fire you. They can in fact refuse you a job, and they can they can report you to the board. I'm not sure that's going to be really. It depends on what the board really wants to do with it. But the answer is there are companies that still have zero THC policies, and you have to be very, very careful of that, and you have to comply with it. I mean, companies have the right to be able to do that. That's one side of it. Now, I do have to tell you, I grew up in California. I worked in Silicon Valley for 38 years. We never tested anybody for cannabis. If we did, there wouldn't be any of the high-tech firms that you see out there. There wouldn't be any Facebooks. There wouldn't be any Twitters. There wouldn't be any HPs. There wouldn't be any of those Oracles or anybody else like that, because it was a fairly wide open use that's out there. Now, I do think that, in fact, it was interesting. I saw a study that was done by a firm, I don't know how reliable it is, that the number of companies here in the state of Florida requiring that have zero policies towards cannabis is going down. Now, that doesn't mean that it's a huge trend, but there is a trend of companies that have just simply said, look, if I have a good employee and they need medical cannabis to be able to perform in their job, then a lot of companies are tolerant to that. Now, that being said, if you're a truck driver, you're driving a forklift, you're doing anything with machinery, you probably won't find them to be tolerant. You probably, just like alcohol, they'll have a zero policy that's out there. So the answer is yes, you are correct. They can in fact do that. And in fact, there's been movements and legislation proposed to protect people, but it has not been passed. And until it gets passed, you're subject. Just ask the company, are you in fact zero tolerant? That's the best way to put it out there. Joe, your thoughts?
Yeah, it's one of those things where you have to know what the policy is at your employer. If they're, if it's a federal employment status, then they're probably going to have a zero tolerance policy, since cannabis is still federally illegal. If you're, like you said, having to operate heavy machinery or a vehicle or anything like that, these are private companies, and their policies are up to them, and you need to understand and respect that. And I wouldn't advise trying to call their bluff, because chances are they're not bluffing and you're going to lose your job.
Right. Yeah. And I think don't tempt the bear.
Right. Yeah. Don't put yourself in that position in the first place.
Although I have found it's interesting to see how a lot of that has become, let's just say, I think the big companies are still zero tolerant. A lot of the smaller companies are beginning to realize that it's the best way of finding good employees. So again, ask the question, don't tempt the bear. And it is, in fact, they can, in fact, take that position. Will this be available to watch again? And if so, will it be available to see it? The answer is yes. Go to our YouTube channel. If you go to YouTube to marijuana, it's marijuanaaware.com. Go to Marijuana Aware in YouTube. You'll be able to find all our videos. You'll find the video that's the video by itself, the one that we played during the webinar, and then you'll actually find the video of the webinar itself, which has the questions and answers that are in there. So both of them are available on our YouTube channel. And a lot of doctors and a lot of patients use that channel to be able to find out not only about medical cannabis, so you can find out about terpenes, you can find out about dosing, the basics, as well as how it works with anxiety, stress, pain management, and that type of thing. So please feel free to take a look at that. And we'll put a link in here that you can be able to see that particular link. By the way, as a follow-up to this webinar, you'll get an email from us. It'll give you a link to the video. It'll give you on YouTube. It'll give you a copy of the presentation that's going to be in flipbook format. It'll also give you all the resources that you can see here, how to find things from Surterra, as well as Marijuana Aware. Keith asked the question, does anybody know when suppositories, if ever, are going to come back? You don't carry suppositories, do you?
No, and to my knowledge, at Surterra, we never did. I think there are certain items that could be used in that way, but that's not how they were sold.
Yeah, I know that there are two other dispensaries that do have suppositories that are out there, both Move and True Leaf, and so they actually carry those products. I think It's the question is how popular they are and the research that's been done behind it. I think both of those are a couple forces to be able to look at if you're looking for suppositories. Sandy says, I have mets in my lungs and my oncologist said not to use flower or vapes. What is your thoughts on this? Well, first of all, anytime a doctor comes up with any recommendation, I would listen to them because they obviously know what they're doing. I can tell you that if you take a look at inhalers, the bronchial inhalers, forget cannabis. Bronchial inhalers have been used for a long time to help people with lung problems because by being able to put the medication directly into the lung and treating it directly, it really helps. And there are those products available in the cannabis market itself. So I think it really depends on you. I would say that if it's possible to not use a vape or a flower, do so. Okay, I think that don't tempt the bear. There's other routes of administration. There's no sense taking the risk that's there. Again, be careful. Yeah, I'm always careful about people's lungs and what's going on. Yes, there are these metered dose inhalers, but I'd probably take a look at some other tinctures, edibles, patches, things like that first to really try to address that as well. Again, it can be very beneficial, but again, you need a medical doctor. We need to look at your particular situation to address that. You said, can you say a website again to ask for the rec bills? I don't think there's a website that talks about web bills. There is a number of, if you do a Google search and you talk for recreational, medical marijuana recreational bills in Florida, it'll give you the main ones that are out there, give you the two that are currently competing for people's attention. The other is you might want to go to a group called NORML, NORML, because they actually follow this very closely, and NORML can give you some information on the rec bills here in Florida. So I hope that helps a little bit. That's out there. I don't see any other questions. I don't know if we have any that are out there.
There's one that I'm seeing about, is it true sativas and indicas act different for someone with ADHD? I've seen this come up before. I think they certainly can. A lot of times with people with ADD or ADHD, their brain chemistry can be somewhat inverted, and that's why they prescribe stimulants to help calm them down. Does cannabis act in that same way? Tough to tell. It depends on the person. It's one of those things that depends on the individual. There's a couple of members of my staff who feel like they get opposite effects from sativas and indicas. And one of them I know does have ADHD. So it's something where it's possible. I wouldn't say that that's definitive.
Right. I know that I've met people and I've worked with people who, interestingly enough, that CBD has the opposite of has the THC effect for them, where THC doesn't. It has completely opposite effects to them. I know two people that have that particular condition. They have to worry more about the CBD use. They get high from CBD and not necessarily from THC. That's a medical condition. I think I heard that one of them was telling me, because they're in the medical cannabis field, that there's something like 1.5% of the population that falls in that category. And that might fall into this particular area as well. But I think that ADHD is something where, you really want to be able to calm down. You really want to be able to relax. And I think that's where indica relaxes you. Sativa energizes you. Those leaning products, there aren't pure products anymore. Those leaning products can have an effect on you. I do know in a couple of cases of people in my family that had ADHD, we did use medical cannabis and it did work very effectively. And we were very CBD dominant products that we were using to really help them quite a bit. Your thoughts on that? Joe?
Yeah, couldn't agree more. It's you have to be aware of what your personal body chemistry is and pay attention to what your body tells you. So if you try a certain product that is supposed to give you certain effects, and that's not what you experience, take note of that. Write that down. Try something that's similar. See what happens. Try something on the other side of the spectrum. See what that does. It's the human body is very complex. We're still learning different things about it every day. Cannabis is a relatively new form of medicine, especially in the United States. So, none of this is gospel. You got to that's why there's such a trial and error process. And that's why we give you so many wonderful discounts so you can help figure out what you need.
Right. Well, listen, we've gone on for quite a while. We've answered a lot of questions. I first of all want to thank everyone who is still watching the webinar. Thank you very much for hanging in there. Hopefully this has provided information that can help you with your cannabis journey, can help you be able to get your life back and be able to address your particular situation. That's why we do this. If just one person gets a positive experience from this, then this has been successful. And we really hope that that's you. Let's have some closing comments. So I thank everybody for watching this. Naturally, we have some upcoming webinars. We have one on chronic pain and acute pain on the 16th of August. And then on the 30th, we're talking about stress, anxiety, and medical cannabis. Please join us for that. And naturally, go check out our YouTube channel. Before we sign off, Joe, any comments?
I just want to thank everybody for the time and the opportunity to, share my expertise and get some of yours, Mark. And I appreciate the opportunity to share what I see on the ground level and hopefully help some people navigate this journey. I appreciate it.
It's something that a lot of people headed into. Unfortunately, it is new and we are learning a lot about it. Candidly, pharma drugs are the same way. Talking to a lot of doctors about cannabis, they'll tell me that the pharma drugs, new drugs coming out, it's the same thing. They're trying to figure out what's going on as well. So it's a matter of you have more control in this particular situation. But yeah, I think you're right. Joe, thank you very much. Your comments were welcomed and we appreciate it. Forrest, you've been the sage advice in the background. Any comments?
Once again, Mark, I really appreciate the opportunity to share my knowledge and expertise, Forrest. Same to you. Thanks for giving me this opportunity. It's a pleasure to meet you both, and I appreciate the opportunity to, share what I know and learn some things along the way. So thank you.
Thank you. Forrest?
Yeah, absolutely. Speaking about the regulations, the Florida regulations are crazy. Let's just call a spade a spade. From the year that you get a card and then the 7 months on the doctor and whatnot. And I would just say, the laws are new, get involved. The laws are changing. We oftentimes say that there's a lot of people making laws that don't actually understand cannabis or understand how it works and making laws about it.
Right.
And that's why you see things like so much Delta 8 and different product out there that's not even regulated and things like that. And so just get involved to help bring it to what it should be instead of letting it stay in the state that it is, because that's how you end up with these miscellaneous, really weird things around all of this. And so definitely get involved, vote, sign petitions when you see them, listen to the dispensaries that are talking about it and taking advantage of the ways that they have to get involved for sure.
Right. Well, sir, thank you very much, Forrest, for not only your contribution tonight being our sage advice in the background, but I want to thank Surterra and I want to thank everybody else who is attending this webinar. And more importantly, we have a couple people in the background that aren't on the screen but have helped quite a bit, and that's Lee and Leah have been helping answer some questions and getting information that's out there. And thank you very much. I want to also thank a lady named Calissa Katera who came up with the idea of doing this, and without her, we wouldn't have had this particular program. So thank everybody for their any questions, please let us know. And we look forward to seeing you on the 16th. Thank you very much.
Thanks a lot.